Anytime someone goes in for surgery, whether it's routine or something groundbreaking, it's a huge deal. The goal is always the same: get the best possible outcome. But what if we could make that outcome even safer? Not by using general rules, but by truly understanding the one thing that matters most: you, the individual patient. Let's dive into how a new wave of technology is making that a reality.
I know, it sounds a little wild, right? How could drawing a clock have anything to do with surgery? But believe it or not, this question is at the very heart of a massive shift in how we approach medicine. We're about to see how something that simple is unlocking a whole new AI-powered future for patient care.
All right, so how do we connect the dots here? From a simple drawing all the way to a safer operating room? Well, it all starts by recognizing a fundamental truth. You see, for a long time, doctors have relied on these things called risk scores to guess at potential complications. And they're useful for sure, but they're often based on these broad averages. They can tell you the risk for, say, a 65-year-old man with a certain condition, but they can't tell you the risk specifically for you. We've got to get more personal.
And this is the dream, really. A world where your entire surgical journey, from the prep weeks before, to the split-second decisions in the OR, to your recovery back home, is custom-built for your specific health profile. But the big question has always been, how can we possibly manage all that complexity for every single patient?
So, what's the secret sauce here? Well, the answer lies in a technology that can spot patterns that are just invisible to the human eye: artificial intelligence. But it's probably not what you're thinking from the movies.
Now, it's super important to get this straight. This is not about replacing doctors. It's about giving them a co-pilot. An AI that can analyze this enormous, tangled web of patient data in real time, basically turbocharging their ability to make the best possible call. Think of it as the ultimate assistant that sees the entire massive picture all at once. And this AI co-pilot is there for the whole ride. Before you even get to the hospital, it can give a much more accurate prediction of your personal risk. During the surgery itself, it can help flag things like a potential drop in blood pressure. And afterward, it can help monitor you remotely, maybe through a wearable, catching little problems before they become big ones.
Okay, so for an AI to be this smart, this effective, it needs good information. A lot of it. And just like any good detective, it can't just rely on a single clue to crack the case. Think about it. A single blood test or one reading of your vitals, that's like finding one footprint at a crime scene. It's helpful, but it doesn't tell you the whole story. To really understand what's going on with a patient, you need to gather all the clues and see how they fit together. And that brings us to the core technology that makes this all possible. It's called multimodal AI. Now, modalities is just a fancy word for different types of data. So a multimodal AI is a system that isn't just looking at numbers or just looking at images. It's designed to take everything in and find the hidden connections between them. And wow, the kinds of clues we're talking about are all over the map. You've got imaging like your CT scans and MRIs. You've got tabular data, that's the classic spreadsheets of your health record and lab results. You've got plain old text, like the detailed notes your doctor types up. And you have time series data, like the constant stream of information from an ECG heart monitor. Multimodal AI is built to understand all of these different languages and get them to talk to each other.
All right, so we've got all these different clues, all this different data. The big question is, how does the AI actually combine it all or fuse it to get one single powerful insight?
Well, there are basically three ways to do it. You could use early fusion and just dump all the raw data into one big bucket right at the start. Or you could use late fusion, where you analyze each piece of data separately and then just average the answers at the end. But the real sweet spot, the method used in almost 80% of studies, is intermediate fusion. This is where you process each type of data a little bit first, pull out the most important bits, and then you combine them. That's how you get the richest, most meaningful connections between all the clues.
So let's break that down. Honestly, the best way to think about it is like a master chef in a kitchen. First, you've got your ingredients. Those are the different data inputs. Then, in the unimodal modules, you prep each ingredient on its own. You chop the veggies, you sear the protein. Next, the fusion module is where the chef intelligently combines those prepped ingredients. And finally, the multimodal module analyzes that combined dish to create the final flavor. That's your final prediction. It's this smart combination step that finds the insights you would totally miss if you just looked at each ingredient by itself. Okay, I know this can sound pretty abstract, all this talk about fusion and modules. So let's bring it right back down to earth. Remember that clock drawing from the beginning? let's look at an amazing real-world study that put this whole idea to the test. It's called the Perioperative Artificial Intelligence-Driven Integrated Modeling of Surgery Study. Yeah, it's a mouthful. So we'll just call it Peri-AIMS. The goal was to see if they could use all this patient data to predict things like how long someone would stay in the hospital, how much it might cost, and even their one-year survival rate.
And check out the different kinds of data they pulled in. They had all the usual suspects: data from the operation itself, patient demographics, physical health status. But they added a fourth, and maybe surprising category: a cognitive screener. And what was that test? Yep, the clock drawing test.
And here's the kicker, the big reveal. After testing all sorts of different data combinations, the model that included the data from the clock drawing test was the absolute best predictor for 12 out of 18 different outcomes they were looking at. Just think about that. Adding a simple pen and paper test made the AI dramatically smarter.
So what in the world does that mean? It means these tiny details in the drawings, things like the size of the circle someone drew or the exact angle of the clock hands, were incredibly powerful clues. The way a person's brain organizes that simple task tells you something deep about their overall cognitive health. And it turns out that cognitive health seems to act like a shield, protecting their body as it recovers from the massive stress of surgery.
It's a huge idea, right? But we've got to be realistic. We're still at the beginning of this road, and there are some really important challenges to solve before this becomes standard practice everywhere.
First up, you've got the black box problem. Basically, if the AI makes a recommendation, a doctor needs to know why. We need to make these systems transparent and trustworthy. Second, we have to be so careful about bias. If the historical data we use to train these models has biases baked in, the AI could actually make healthcare disparities worse. And finally, real-world data is messy. People miss appointments, tests get lost. The AI needs to be smart enough to work even when some of the clues are missing.
But even with these hurdles, as researchers are tackling them head-on, the future here is just, wow, it's incredibly exciting. Just imagine this: a digital twin of you, a perfect virtual copy of your body, built from all of your unique multimodal data. A surgeon could then run dozens of simulations on your twin, testing different approaches to find the absolute best, safest path for you, preventing complications before a single incision is even made. That is the ultimate goal of personalized medicine, and AI is the key that's finally going to unlock it.